Hello and welcome to Sustainability Matters. I'm Agatha Afemike, your host. On this show, we delve into latest developments and innovative solutions in sustainability. Each episode will bring you expert insights, impactful stories, and practical tips to help you make a difference. Sit back, relax, and enjoy the episode. Hello everyone, welcome to today's episode of Sustainability Matters. As always, I'm your host, Agatha Afemike, and I am thrilled to have a very special guest with me today, Jolaoso Solomon, who is a public health consultant. Thank you so much for joining us, Solomon.
All right, thank you, Agatha. Thank you for having me on your platform. I'm so happy and so glad to be here today.
Awesome, good stuff. Before we get into it, I want to set the stage for our viewers. Today we'll be exploring how to combat the cholera crisis in Nigeria. This is a vital issue that impacts us all, and I can't wait to hear Solomon's insight on this matter. Solomon, it's a pleasure once again to have you here. How are you doing today?
I'm doing great. I'm excited. I'm elated. I'm ready for the interview and what I'm about to share. I feel elated to share my knowledge and my insight into the cholera issue that we have on ground in the country. So I'm happy. Thank you so much for the question.
Okay, I would like to introduce you, but I think you do a better job at that. So I'd like you to give a brief overview of what you do, especially around public health consulting, and why we've called you to speak on this issue today.
All right, thank you so much. Like you said, my name is Solomon Jolaoso. I realized I didn't get my pronunciation correctly. So it's
sorry about that. Sorry.
It's fine. So it's Jolaoso, and I'm a public health consultant. Public health is a very wide field, and it has a lot of sub-field in it. So generally, I do consulting in public health. Any field you want to talk about in public health, you talk about epidemiology, you talk about occupational health, environmental health, you talk about community health. So it's a lot of our field, and even in public health, we have communities, we have groups. For example, to talk about HIV community, hepatitis community, we talk about LGBTIQ community. So a lot of community and a lot of community in public health. So I practically do that. Majorly, predominantly, I'm in the occupational community, occupational health and environmental health.
Okay, good stuff. So do you want to walk us through how you got into the public health consulting space? I say this because I want to give them a bit of a background. I do not know Solomon personally, but from his interactions on Twitter, which is now known as X, he has been tweeting consistently about the cholera crisis that's been happening in Lagos so far, almost daily, more than once daily. I think he has given people that follow him, myself inclusive, more of an up-to-date update on what's going on with the cholera crisis. So I want you to give me an overview of how you got into the public health space and what is foiling your passion for this field of work.
Well, thank you so much. So basically, I graduated from University of London. I studied biochemistry for my first degree, biochemistry. And while I was graduating, I remember a friend of mine was asking me what to start after school. I've always had the clarity of what I was going to do. I told him, is that I go into public health in this country or I leave the country, I go into biomedical engineering. So I had this clarity right from time. Sorry. And even before I left university, I've been engaging myself in some professional courses and predominantly in public health, professional courses. So it was a very easy transition for me to move from biochemistry into public health professionally, to professional route. And then even after my NYSC, I took a professional course on occupational health and environmental health. When I started, I went to a firm. I started as an intern in the firm, and from there I started building my my work, my skills, owning my skills, and all those things. Yeah. So eventually, I'm currently the operation manager for the firm that I interned with when I started my career. So thank you so much. So it's a consulting firm, and you work with government, you work with organizations, you work with virtually everybody. I mean, big organizations, small organizations, businesses, individuals, and what just mention them. So I basically work in several industries, a lot of industries. You work in construction, manufacturing, biomedical, pharmaceutical, healthcare, hospitality, agriculture. So just food, just mention those communities. So I work virtually in all those industries.
Interesting. That's a very wide range of experience. Well done, Solomon. Okay,
Thank
so
you.
moving on into the major reason why we're here today. As of last year, that's 2023, Nigeria reported at least 30,000 suspected cases of cholera and recording about 1,200 deaths. That is a lot for a country to be recording in 2024, given the Industrial Revolution, the times we're in currently. I personally don't think anyone should be dying from a disease as curable as cholera. So I want you to give us a brief overview of what your understanding of cholera is, how is it gotten and how is it treated?
I mean, even me getting on this platform, I think I actually appreciate it because immediately I've been trying to keep trend on cholera since we have so I say have a buzz on Twitter, on X about cholera outbreak in Lagos. Everybody be careful, be careful of what to take, what to eat, and all those things. I took it as an interest. Then I started working on cholera as a personal interest. Not so many things, and in fact, when I started discovering all these things, and did I say I was overwhelmed and a little bit disturbed that in fact, let me even say I was sad, or even I'm still sad. So basically, cholera was a infectious disease that it attacks your small intestine. When you consume a particular bacteria, it's called Vibrio cholerae. When you consume it, fecal oral route, and you get into your system, to your small intestine, you colonize your small intestine. Before there's a lot of series of biomedical reactions that occur during those periods, and that's a incubation period of 1 to 5 days. That means that 24 hours, 12 to 24 hours, and 5 days. That means that if you ingest the bacteria today, you should expect that you could have a reaction. It could actually fall sick within 12 hours to about 5 days. It attacks the small intestine, and there are a lot of processes that is involved. So let me just take us through the process that it is involved. When you inject it, maybe from food, or your hand is contaminated, you now hold the food, you eat it, it's going right into your small intestine. The reaction starts from the mouth, it goes into your small intestine. You get so at that point, bacteria will attack at your small intestine, and the particular one that is very common. The one that is responsible for this particular outbreak is 01. We call that 01. Currently, the strain that is responsible, a very virulent strain. So when you attack your small intestine, you start colonizing it. So it starts creating cholera toxin. It will produce cholera toxin. So the cholera toxin has two sides. You have a subunit and the B subunit. Are you with me? So the B subunit will attack at your glandulocyte, your small intestine. You get it? So when it attacks, and it will now be taken into endocytosis into what's it called, your cells. So once it gets into your cell, that's the beginning of a long time problem. So because when it gets to your cell, the other side I said, the A side, it is this side that gets attached to glandulocyte. And the A side gets activated. Once it activates, the A side activates like this, then it activates an enzyme. You get when the exam starts, that particular exam will not activate another reaction. It will convert ATP. ATP is what's responsible for our energy. I'll be able to do work left and right. This is like layman explanation. Are you with me?
Right.
So ATP. So that particular exam will start. We actually activate that reaction again. It work on ATP and convert ATP to CAMP. That is adenosine monophosphate. So once it converts that, then that one will trigger chloride in your body. Are you with me? So once there is when an elevated form of chloride in your body, then the body starts to react. The way the body is created. Our organs is like it has to be in equilibrium. When something is too much, the body will try to fight back to bring it back to balance. So when you have an elevated level of chloride in your body, the body starts releasing water along with some electrolytes, potassium, sodium, important electrolytes. So it is like you have the bacteria in your body and they replicate at a very fast speed. They are already in your own. So it is a very serious the cycle. It goes on. You keep having elevated level of chloride, the body keeps running out water, That is when it becomes too much for your system that your system cannot take it. You start vomiting, start stooling. That is why you have watery stool and we have vomiting. Again, so that's like the reaction involved. Person start vomiting. Of course, once you have issue with your system, there are some symptoms you're going to observe. Perhaps like a fever, like fatigue, So, but the point is, when you start vomiting, you start seeing watery stool, and that is you can suspect that there is and a visitor in the body, and that is probably a bigger cholera. The cholera.
Right.
So when you get to that point, the body will be fighting to balance those electrolytes in the body. But still, the bacteria in your body, they are doing their thing. They are triggering reactions left and right, and you keep on going to toilet, trying to purge all those water in your system. So in that process, you are losing electrolytes. And electrolytes factors are very body functioning. So the moment you start losing electrolytes, your body, your organs will enter a shock mode. They cannot function properly again. The system enter a shock mode. That is when it gets very severe and it leads to death. You get it. So that is a breakdown of how a layman explanation of how the reaction occurs. So at this point, like I said, for cholera, if you can treat it right on time, the moment you start feeling somehow, you can go to hospital and get you tested and they see that okay, fine. You might have cholera. They start treating you. You stand a very good chance of surviving. But instead, the moment it's left untreated, that is when it becomes a problem. You start losing electrolytes and you start losing a lot of energy, a lot of electrolyte that is supposed to help your body. That case is death. And based on record and based on data, when it is not treated, the death fatality is about 50%. I'm serious, that is 50%. So it's very severe when it is not treated. But once you can get treatment, it can be brought under control. What is the treatment? It's very simple. You're not supposed to, do self-medication anyway. You need to first confirm that it is cholera because it might share some symptoms. It's not like it might. It shares some symptoms with other diseases, and they have to confirm that this is cholera. So when you go to the hospital, they treat you. They need to first, and you're losing a lot of water, a lot of electrolytes. They need to first give you make sure that they restore those back into your body. Then you have ORS, that is the hydration, solution into your body so that they can try to stabilize that as you are losing the replenish back. So they recommended that if you're having a serious case, you should have about 2 liters, of dehydration in a day in 24 hours. At the same time, it's a bacteria, you need to be fought. They are going to fight it. The doctors, so they have antibiotics they use to fight that. Once you get treatment, it's not something that is very serious, but when it's left untreated, it's a very, very serious disease.
Interesting. Thank you for that breakdown, Solomon. But as you were speaking, I was imagining cases where a disease as treatable as this leads to big cases of death, as we've had it in the last few years and even in the last few months that we've been dealing with it. Does that mean that a significant number of people who do not have access to treatment, access to antibiotics, or access to good health care to take care of something as inconsequential as having water, having antibiotics in their system to combat this disease?
Well, that is a very complex question. And in fact, attacking that question, we actually involve talking about so many things. Like I always say, I mentioned one time on X that the index case in Lagos is what traced back to a tiger nut being there, someone, but based on, I think it was the advisor to health that mentioned, that gave us that briefing, And I kept on asking myself questions that, tiger nut bean, how come? How did it happen? At what stage of production of tiger nut bean did it get contaminated?
Right.
Are you with me? And I know government will say perhaps it's the problem of a person that took unregistered tiger nut bean. That's what they called it, unregistered tiger nut bean. That means that the person that produced that tiger nut bean does not have that registration. Have that registration. Do you get it?
Right.
So basically, what part does government actually play in this? Because that is about 29th date. That starts 25th of this month. You have about 29 dates in Lagos, and that is someone's brother, sisters, husband, family, someone's breadwinner that's died. In fact, someone's lone child that's died of cholera. So these are deaths. These are people. These are things that are not supposed to be happening. You can actually pinpoint the domino effect of this death on people. In fact, even if they give birth to another children, another person, what about the trauma that stays with them forever? That something as simple as cholera in 2024 is killing their family member. Yes, when you talk about treatment, talk about people dying, then it boils down to so many things. And number one part of it is actually access to treatment. In fact, having the cholera in the first place is appalling in 2024. In fact, in Nigeria as a whole, it's very appalling. Someone having cholera, you have to question it at this stage, But someone that's not getting treated for the cholera is another problem entirely. But of course, you cannot totally blame maybe the government or whatsoever because, even attitude to health, you call something public health, attitude to health seeking behavior. So people don't go to the hospital to get treatment. they don't go to, they're trying to self-medicate. Maybe someone is start feeling, that okay, he's purging, he's going to at the toilet frequently, things that is maybe normal. Every time in the past that he was purging, maybe as a result of too much consumption of beans, and he started using flagyl or loperamide or whatever. You get
Right.
So those are like the issues that we have. So we cannot entirely blame those that are on access. Sometimes it's just like the health seeking behavior of people. At the same time, so it's actually like access to proper health care. We've had places of incorrect diagnosis. People go to hospital and because initially as at this year to like June 2nd, we had only one case in Lagos. You get it. So when someone now start presenting the case, the symptoms of cholera, it's more likely that whoever is diagnosing the person might not think of this could be cholera at this point in time because
Right.
we're not having an outbreak. You get it. So there's cases of people being misdiagnosed and that might be too late when they start intervening. This may not be what we are treating might be cholera, and it might just be too late that person may actually die.
Yeah.
So it's not the factors leading to death. Like I said, access, health-seeking behavior, even
Right.
information. People don't know. But once people know that is this might be cholera, they might actually like go to the hospital on time. So a lot of things like that. Yes, access is actually part of it. Yeah.
Thank you very much for that feedback, Solomon. I say this because a lot of people are going to be watching this video after we've recorded it, and they would like to know. There's this common conception that the government is the major cause of deaths as a result of cholera, and that's because healthcare facilities are not accessible. But now you're giving us another perspective that some people's attitude to health, their health, is not good enough and may lead to their death. So thank you very much for that perspective. Can you give us a brief overview of Nigeria's history with cholera, especially for the last 5-10 years? Has there been improvement? Would you say the cholera cases have not been as frequent as they used to be in earlier years? Or are we where we used to be? Have we not made any progress at all?
Thank you so much. The one thing people don't know currently that currently we're having a cholera pandemic. Of course, it's not like we're having it currently, it's ongoing. In fact, the cholera issues you are seeing outbreak here and there is a result of a pandemic that started in 1961.
Interesting.
I'm serious, the Indonesia. So is that pandemic that we are still seeing the cases up until today. So when it started in 1961, I think that was like the 7th pandemic of cholera. So countries became endemic to cholera. And in fact, it is layered. It's something like you should be proud of as an African because we have so many countries that are endemic to cholera today in the African continent. We started in Indonesia, Asia, you get it. But we have countries that are actually endemic to cholera. As of today, most of African countries are about 36 of African countries out of 54, if I'm not wrong. It begs for so many questions. As far as Nigeria is concerned, yeah, we have some improvement over time. But public health can be very tricky. It can be very tricky because there are two types of indicators. We have leading indicator, we have lagging indicator. So lagging indicator is like behind us, and leading indicator is like what the parent institution is telling us. Say for example, I've been able to give the past 10 years, but someone has not actually changed. And I'll tell you why. Because we still have outbreak consistently over time. In 2021, Nigeria had about 100,000 cases of cholera.
Wow.
2021, 100,000 cases of cholera. I'm serious. But interestingly, last year, total cases of cholera last year is about 3,000 cases, yeah? Last 2 to 3 years. You get it? So about the year preceding, 2022, what about 23,000 cases or thereabout? Are you with me? So if you look at those figures, you could say that yes, there has been a drop of cholera cases over time. Don't forget, there is still problem of under-reporting. You get it? In fact, WHO also have that problem now. So people don't report cholera cases. So there's still problem of under-reporting. But based on the confirmed data from NCDC, our own agency in charge of that, disease prevention, those are like data from there. So at the point in time, we had 100,000. The following year, about 20,000, and last year about 3,000 cases in total, suspect cases in total. So there is some. If you look at the backward, it feels like there have been some improvement, but that can actually be confusing. And actually, I will tell you why. Say for example, last year Lagos did not record any single case of cholera, but today, as at 4 days ago, on the 25th of this month, Lagos had about 500 cases. I think 528 or 526 thereabout. Last year they had nothing. In fact, January to June 2, June 2nd, they had only 1 case. So you can see that when we focus on lagging indicator, it can actually mislead us in public health. So we
Right.
try to focus on our leading indicators. What is happening? The influence are affecting this particular outbreak, because just a few mistakes and it can actually go out of hand. I mean, we have 2 weeks, 3 weeks ago, or 4 weeks ago, Lagos were not seeing any cases. Now they have about 400 cases. And if care is not taken and is not properly contained, you can see that Lagos is recording about thousands of cases. There are just some few, half of 1,000 away. Are you with me? You get? So at the point in time, there are some states in Nigeria that were having 12,000, 15,000 in 2021, like I said, cases of cholera.
Right.
So it can happen. We cannot see cholera as a whole. I mean, we cannot see it in ordinary eyes. That is like the major problem. So we don't like to stay on our gains in the back, because if you look at those things that the proper ingredient that makes all this make us having this outbreak, you can see that most of them are still much around.
Right.
You get it. So we cannot we have made some of them in the past through some intervention, but still, cholera is like cancer. It stays, and if you're not careful, once you're endemic as a country, anything can actually happen at any point in time.
Right. Thank you so much for that breakdown, Solomon. I'd like to speak on the numbers we're having so far across the geographical spread. I know of cases in Lagos because I stay in Lagos, and I've been keeping abreast of these cases in Lagos just to be informed on how to conduct myself, especially with eating outside and taking water outside and all of that. But let's talk about cases in other states outside of Lagos. What does that tell us? The geographical spread, the numbers, does that tell us? Is Lagos at more risk of this disease, or there are other states that are recording these cholera cases but they are not reporting it?
Thank you. I actually don't believe that there are some states that are actually experiencing, seeing cholera cases that are not reporting. There are regulations and standards as to that. They might be under-reporting, maybe some people not go to hospital to confirm that it's cholera or whatnot. But I don't think that it's it. For example, over time, for the past 3 to 4 years, outbreak in state has been ranging from about 28 states to 31 states. I think that the highest we've had over time is about 31 states out of 36 states in the country. You get it. So I believe that all over the country at the moment, we have about 30 states at minimum that are actually dealing with cholera currently. Are you with me? And yes, once you look at what data is telling us about what the geographical outlook of the outbreak or the disease currently, the point is extreme. I'll just put extreme. Normally, I used to have we anticipate by standard. We anticipate cholera cases during rainy season, and you get it. And at the same time, we also anticipate cholera cases in some situations, some conditions. Number one, anywhere there is conflict and war. Are you getting me? Anywhere there's conflict, we anticipate cholera cases because of the access that it brings. War as a whole. You have many displaced people, don't have damage to public infrastructures, they don't have access to good water, they are cluster way of living, they are in IDP camps. So we expect cholera cases in those kind of situations. At the same time, we expect cholera cases in places that experience less rain compared to places that experience higher rain. So it's too extreme. If they haven't no rain, that means that access to basic water might actually be quite difficult. In the cases where the government infrastructure are lacking, people have to go miles, and in fact, even going miles, people will try to make use with easy water they can get, even if water they are getting is contaminated water. You get it. When there is scarcity of water, just make do with what you have at the moment. And what you have can actually be what? Contaminated water. So the extreme cases, and extreme cases you always have cases of cholera. So that is it. Currently, we have Bayelsa on top of the table. Lagos is about to beat Bayelsa or so. I'm not so sure. But we know that there are 3 cases out there in the country at the moment: Zamfara, Lagos, and Bayelsa. You get it. And Zamfara be very consistent, very, very consistent. If you look back over the years, you see Zamfara always, in fact, in the year 2021, they had tens of thousands of cases in Zamfara. Consistently, they're having serious cases. Even if some are having 9, having 10, having 18, you see Zamfara leading them by a mile. That institution in that particular part. I actually don't know what exactly is contributing to the high number. But of course, based on our knowledge of our situation in the country, we can actually have a point. Perhaps it's insecurity, insurgency that is going on in that particular area, high level of poverty in that particular environment. So we have issues like this that dictate how we have cases of course, clusters and urban area. Lagos as a whole, you can see Lagos overpopulated, very big. People live in clusters, and you check infrastructures, and in Lagos you see that when I talk about infrastructure as a gang I'm talking about wash. That is water, sanitation, hygiene. In Lagos State, you can see that it is not something that we can actually write so much home about. So the contributors are influence cases across the country. poverty, insurgency, coastal area with coastal regions. I mean, our riverine areas, it is disease cholera that predominantly like stay in water, get in water, you get it. So those are like the factors that contribute to the cholera cases over the country at geographical people of cholera currently.
Interesting. That means you can draw a direct straight line between poverty and the outbreak of diseases like cholera.
Yes, very correct. You can actually draw it because in fact, like I said, I mentioned earlier in the beginning of this time that I was overwhelmed. I was sad that this cannot be our reality. I mean, this is Nigeria, one thought to be a giant of Africa at the point in time.
Right.
And we are having this country. I will tell you for a fact, Agatha, if you check the data worldwide, you realize that countries that Nigeria is like leads with in this cholera situation, being endemic, endemic to cholera, are most war-torn countries. I mean, countries that are actively in war, were in war. Countries with high rate of poverty.
Right.
Mention them. You can just make a wide guess of a country that is war-torn at the moment. I can tell they are endemic to malaria, they are endemic to cholera. And Nigeria is not at war. Okay, further right, we have a geographical insurgency. But Nigeria is not at war. Look at Lagos. Lagos is not at war. You can attest to that. So those are like the issues. I mean, yes, poverty you can draw a straight line. Because I will tell you why. If I cannot afford to buy water, I'll make you the water I can drink. I've seen people that drink water, untreated water from their tap. Who drink well? I mean, I was somewhere of recent and I saw a little clip. It ran to a well that I was telling someone that I cannot use this to wash my clothes. I saw a kid run to the well and I'm too some water from it. He drank it. You get it. So those are like our issues. I mean, poverty. People cannot afford to buy water. I was on the back at the time. The back man said, rather than him paying, when, the cost of sanitary was just a case of recent. And back man was saying, instead of him spending 15 hours to get some water, we'll just go and bring water from somewhere and put in his keg and carry on at his back because they cannot afford to drink and afford to get water. So you can connect it. I mean, even your way of life, I mean, your infrastructure, because you are not wealthy. I mean, even like wealthy, I mean, middle class family, if you cannot have a house of your own, you cannot have a water of your own, how then can you be a clean person? How then can you be hygienic? You get it? You still dedicate outside. At the point in time, I was reading reports on Chibu, and they did. I think that was in 2020 or thereabout. And people were complaining that even though they were private toilets, I think perhaps I'm not so sure. Local government. And people though they were private toilet. People that you can come and use the toilet and pay. You have them across areas like that. In those places, people still openly dedicate. They were questions and say yes. How much they make from their daily job, paycheck to paycheck every day. They have to work today and make money today. How much are they even making? That they have to now go and pay. And they have to go and pay to obey the nation. You get it? They prefer to just go openly and go and do their business. So those are like how you can trace poverty to cholera cases. Someone is defecating openly, in fact, to river, go to streams, and you see them. Someone is actually defecating somewhere. That's how cholera will get into the water. Someone will fetch it and someone to cook at home. And in fact, someone going to work out to fetch water, when instead they can just have a borehole in their house and they can just open their tap and get it. So someone that is still going to river to fetch water, can they treat their water? So those are like how you can connect poverty to all these things. It's a very serious case. I mean, Nigeria is endemic to water, and Nigeria is on the same playing ground with war-torn countries, countries that are at the brink of poverty. So that's it. You can draw
it's very, very saddening to listen to this, and it actually ties me to my next question. I want you to give an overview of what the governors of these various states, let's focus on owning on Bayelsa, Zamfara, and Lagos, what they are doing currently to fight this cholera crisis. Do you think, in your own estimation, that they are doing enough? If they are not doing enough by your estimation, what should they be doing more?
In fact, if I want to be biased, I would say they are not doing enough. The only state that can rate a little bit of rate, I rate a little bit is because rating is Lagos. Even that, I still have my sentiments. Because I know, like, when I was trying to get myself, let me just even know the landscape of cholera. Let me see what is going on in the country. As a concerned citizen and a concerned public health person, and I have issues assessing data. That is one of the key pillars of public health. Access. Everybody must have access. The poor, the old, the young, they must have access to everything. Information. Right. If you don't have information, how do you make better judgment and informed decisions? You can't. So even currently, as we're having an outbreak in this state, we're having issues with accessing data. In fact, I cannot even tell so much about Zamfara or Bayelsa. The only thing that I rely on is data from NCDC. And even NCDC, the last time they gave us report on cholera, comprehensive report on cholera was 7th of this month. Since then, that is about 4 weeks now. And about 5 days ago, they activated EOC, that is the Emergency Operation Center. So anytime there is an outbreak, a serious emerging pandemic or emerging epidemic or a serious outbreak, that's when the agencies activate EOC. That is the Emergency Operation. That's where they operate from. You get. And since they activated the EOCs in about 5 days, we've not gotten any comprehensive report on cholera. That's why I tweet on X and I'm talking about 105 cases in the country so far. But it's not sufficient. I can't access information from Zamfara. I can't access information. In fact, I've tried to access information from Ogun State. I can't. I have to rely on daily news. It's okay if they are going to report it. They don't report it. I have no access. And where the platforms are there, the medias are there for the states to be using to communicate people. Of course, you can agree with me that X is one of the most vital social media in the country, based on how things have gone from that space to even physical reality. So even this country are not even leveraging this social media to communicate to people. NCDC, number one person in charge of what's it called, disease prevention and control in this country has not been involved since about 3 weeks or thereabouts. So these are the issues. I can't say so much. I can't say they are working, but I can say for a fact that I was telling a colleague that it's in Lagos State. I mean, in Nigeria as a whole, they are very, when it comes to creative, I mean, curing things, trying to pass things, trying to make sure that things are already getting balanced, managed before it gets so bad. They are very good in it, very diligent in it, So even in terms of that, I can say, if say trying to contain diseases, you can give it to Lagos State. They know they are honest to some extent. I mean, they are not underrating what you have at the moment, because I remember during the time of Ebola. Even people outside the country came to learn how Nigeria contained Lagos State specifically. How they try to manage the Ebola that I think go out the ban. Because considering the ingredients the things that are available in Lagos State, considering the cluster, the level of people, the level of should I say awareness, consciousness, public awareness, public consciousness. When you are dealing with cases like Ebola, is very far down. I know it is a very serious case. Looking at Lagos, it could easily go out of the control, but still Lagos contained it. So I have faith in their team in Lagos State that they can beat this, contain it if they have, like I said, the class is there. If they are very willing to work under directing diseases, but outside the Lagos State, other states, I can't say so much. But I know for a fact that there are some agencies in the country that don't pop their hand and watch. Like UNICEF, like WHO, they don't sit down and just cross them. I mean, they are actively carrying interventions in those states. They always actively carry intervention in those states. Their parents in almost what's it called, geographic location, maybe Southwest, North Central, all those things, but they always carry intervention to states that maybe where you have places of IDP and a lot of IDPs and that person, those kind of intervention. So even if I cannot say categorically that this state is doing this at this particular moment, but I'm very confident that bodies like WHO, UNICEF are doing something. Even the NSCDC agency, I'm very sure they are doing some intervention in those states.
Interesting. Thank you very much for that very detailed review, Solomon. I want you to speak again to what the private sector, when I say the private sector, I mean me and you, people that own businesses, especially in the healthcare and medical sector, what we can do in our own capacity to solve for some of these problems were you've highlighted in the past 30 minutes. What can you and I do to help the system? Because of course, the work that is necessary for a nation to grow and be built is not left to the government alone. Is the citizens have their own part to play, the private sector has their part to play. So what can we do in our own capacity as individuals and as company owners, as C-level executives?
So thank you so much. There are a lot you can do. In fact, I've not even mentioned what the government can actually do in this because I've not mentioned what that is being done. I've not even really going to what is being done in some state I don't remember, but there are courts that are actually intervening currently. So, but what we can do as individuals, private sector organization is that one, we can help join the government in controlling the spread. Because I think by some percent of Nigerian youth, so of the Nigerian population are the youth. Is that correct? And that means that is like youth, the working class age. If I'm not so wrong. So we have some of these individuals working in companies. Some of these are going to work going to get a daily job. So it's also their responsibility as a person to try to help the government in containing the spread. You have to be responsible as a citizen. yourself
Right.
individually. Not be responsible. So a big organization can also do something. I mean, even companies, people spend a lot of time in business places. In companies, in firms, spend about 8 hours, and even that place, they can have what's the spread of the disease. You have contamination in those places. And people who go to those places, they have catering, they have eateries, they have places where they eat, they have canteens and whatnot.
Right.
They can also have spread in those places. So that is where the occupational arms of intervention comes in. I mean, they have to actively put measures in place to manage the spread. If you have, if you see something, say something. You get it. If you see someone showing symptoms, say something. How about prevention? I mean, actively putting measures in place to prevent spread and contamination. Awareness, promotion, telling your neighbor there is cholera. I just get the woman and take a break on my ex and stop tweeting about cholera. Today I still made a tweet on cholera because I've not gotten data from any CDC, and Lagos State Ministry of Health. I mean, just trying to orientate people. I don't know. I've not heard anything. Okay, maybe I don't listen to radio quite alright, but I know perhaps they are doing that in some states. I mean, orientating people, the general public, the masses, actually the poor masses, on a particular issue and what's not and what to do. So we can also take it a step further as individual. Tell our neighbor, and even the big organization can take on campaigns. There are public health experts all about the state that they can engage in intervention. Pay them, and you have the focus that you want to reduce, you want to promote, you want to make people aware about this thing. Then you do it. But then it brings us back because everything we are talking about is still corrective. Because trying to cure, because you can actually actively prevent disease, this particular disease. You can actually prevent it, and that is where, considering our reality, our reality as regard our government and our government reality now, my faith is more on private sector. I don't know. It's not like I've lost faith in my government. I'm sorry to say this, but my faith is more on private sector. The private sector can do something because you can see the NGOs. Look at our development space. You can see that most of the people are doing you see NGO doing this, NGO doing that. Are you with me? So we can. Even the direction can. In terms of preventive, that is most of the place that we have so much to do. Because if you look at currently, Europe has 44 countries, if I'm not wrong, and of late, in recent time, I think about only 2 countries have reported cholera outbreak in their country, just 2 out of 44. And you can compare to African countries about 36. So what are they doing? What are they doing right? What are they doing? Why is it that it's just we here that we are having this particular issue? It's because they are what's it called? Investing heavily in prevention. We must always wait till we have an outbreak before we do something. Prevention, and before it happens, let's prevent it. It's preventable. Cholera is preventable. It's a slap on our face in this country that we are talking about cholera, and now you are sitting down here, you and I are sitting down here talking about cholera in 2024. It's a slap. Even when we're talking about cholera, it should be like orientating people that, okay, this and this, there's something they call cholera, and what's all, don't do this, don't do that. But not like you talking about our predicament.
Right.
So there are a lot of things that we can do, but most of the time, like I say, when we have outbreak like this, most intervention is always carried out by governments, and what you can do is just individually promoting and being responsible as a citizen, treating your water, make sure that you take your hygiene to top notch, top level. But in terms of prevention, there are a lot of things that we can do, both the government, both individuals, and both private sector.
Thank you so much for that, Solomon. I'm sure there's someone that's going to listen to this recording and decide to at least take better steps to take care of their health and the people around them. So thank you for that, Solomon. Okay, so moving on, what is your future outlook for this conversation in the next 5 years? What kind of improvements do you want to see for Nigeria? I'm pretty sure I personally do not want to be sitting to talk about a live case of cholera outbreak in a nation as Nigeria in the year 2024. So what improvements do you want to see? In what way do you want the conversations to stay, at least in the next few years?
Perhaps maybe they say that a pessimistic man is a man that was it called, that is an opportunist that is very aware of things that can actually go wrong. I don't want to say that I'm a pessimist, but at the same time, perhaps what I'm looking forward to is I want Nigeria to not be endemic to cholera anymore. It's, in fact, considering our current reality, that is more like I say fantasy. I want to say, but quite alright, it's achievable. There are countries that are not endemic anymore. You get it. So, just like the correction I want to be having in some. Let's just look back in time. In sometimes we had these cases, and it was not unfortunate that people were dying. 20 people were dying, 30 people were dying. So those were family. But now we thank God that nobody's dying anymore. Everybody's dying. At least it is not. If you are dealing with anything, it's not even. I just call it. It's not death. It's not cholera. Let's just orientate people that there's something they call cholera. Just like conversation we should be having as a country, as a giant of Africa that we always say ourselves to be. Those are the things that we need to be talking about. So I mean, in the next 5 years, I would like as a person that we should not be endemic to cholera again. Although WHO has a vision that I said, I think by they started in 2017. If I'm not wrong, I'm not really wrong. The memory is not failing me. By 2020, they want to eradicate cholera by 90%. By 90%. And maybe if we can key into that, and make sure that we move online, we align with our WHO, we can also by in some years, it's not perfect, it's not far away, it's not far away. In some years, you can say, yes, Nigeria is what's it called? It's no longer endemic to cholera. I mean, in fact, I don't want cholera to kill anybody. It's as simple as that. Anymore. Like that's like the output. But by considering our current realities to what I expect from the country, I mean, I don't know. I actually don't know what I'm expecting.
Let's hope for the best. Let's hope for the best.
I'm just going to hope for the best. That okay, fine. We take this serious. I mean, quite alright. If we want to like look at our lagging indicators. Even for example, by this time last year in June, 2023, I mean, we had about 2,568 cases, or 53 cases or thereabout in last year. And as of June 24 this year, we have about 1,005, about 1,000 cases less. You get it? That we can say that is an improvement, but we cannot sit on that because Lagos was not even actively on the record last year, and Lagos is actively on the record this year. But you get it. So if we can bring all these cases down, and in a year we start having just 2 cases, 3 cases, that means that they're consistent. Please, not like Lagos was not here last year. Lagos is here this year. You get it? Consistent, and to state like Zamfara, we should start having serious cases. You can, even if at all, if cases should start coming down. Although it came down in 2022, even 2023. 10,000, 20,000, 3,000 then to where we are this year. So I hope the trend continues and we stop having outbreak. I mean, outbreak here and outbreak there. I just hope that will be our reality in the next 5 years.
I really hope so too, and I want to bet all I have on this that hopefully in the next 5 years we don't have these kind of conversations come up because the world has advanced more than this. We shouldn't have people dying by the day because of a preventable disease like cholera. So thank you very much for this very, very detailed and insightful expose. I want you to give a key. This is a rounding off question. I want you to give a key takeaway for the audience, people that are going to be watching this. What do you have to say to them, especially as regards the conversation we just had?
Well, I want people to be responsible because, when you look at Nigerian situation, I mean, generally, not only our health system or what, generally, you can actually see that the Nigerian populace themselves have a lot to do, a lot to work on themselves. I know because, like I said, health-seeking behavior is one of the major challenges we have in public health. And when we talk about third world country like ours, developed country, like ours, we need to consider all these things. And Nigeria needs to be responsible. That is the problem. But Nigeria will not be responsible out of the blues, of course. The people that we are learning. I mean, we are very well read, and we can actually start that movement and being responsible Nigerian, taking our hygiene to top notch and making sure that we demand for better realities compared to people that are not really well in tune. Because we need to do better as a person. We actually need to do better. I mean, you see some landlord, some landlord they'll build houses, and in fact they'll not even put toilets. You see some people build shops, they'll not even put toilets.
Right.
You get it. Those are like individuals. Those are not governments. You get it. Of course, there's a part of government to play, regulators need to play, do their part too. But those are like individuals, It's even this individual sometimes maybe I can't say this on the air, about those individuals that they have funny way to how they find their ways. I mean, they will not be toilets by standard. They are supposed to be toilets. You have about 7, 6, 8 shops. They are supposed to be the toilets for them. But they are going to be there for like 10 hours, 12 hours, 8 hours. Why do you expect them to do their business? That's why people start going to the bush, going to the toilet and opening their vacating. So we need to do better as Nigerians. We need to stop this habit of defacing the earth. Some people have toilets, but no, it's still out they want to do it openly. They want to do their business openly. You get it? And we need to take hygiene serious. People don't wash their hands. People go to the toilet, even when there is water, they don't use it. They don't use that soap. So even we, the Nigerian populace, need to do better. I mean, we need to take our hygiene very seriously. Even in terms of infrastructure, it should help ourselves. Government cannot do everything. We are 200 million in population. It's a very big number. I mean, we need to always, try by ourselves for ourselves. I mean, we should do something. I mean, if we can actually, what's it called? Preach to your neighbor, educate them. reject bad reality. Don't be part of a group of people that make sure that you want this bad reality to continue. You see people there, people will go and take their waste and throw it into the what's it called, the drainage. And people are allowing it. We say it, and people see it, and they let it slide. No, it shouldn't be. It shouldn't be. You should connect your neighbor. So at the end of the we need to be better. We need to be responsible in our respective home. We need to now inculcate sanitation and hygiene. It's very, very important. Very, very important. Because if you go out to take unregistered tiger nuts, or you are already infected, although you are not showing symptoms. I didn't mention it. About 70 to 80 people will not show. 70% to 80% of the population will not show symptoms.
Interesting.
To cholera, yes. Sorry. They will not show symptoms. Most of the people will be asymptomatic, but at the same time, they can still infect others. You get it? So you have to wash your hands. You have to make sure that you follow those procedures. Take hygiene seriously, even if they are not showing symptoms. I mean, you are sick. Why then are you still going to work to cook for people to eat? You get it? These are like the issues. You want to make sure that you get that payment for that day. You don't want them to say they want to remove your permanent salary. You don't want them to do this, they want to do that. But please, you have to take that safety serious. You have to take safety of your people, customers, clients, patients, people seriously. You know that you're already showing symptoms of sickness, you're not the person of supervisor. That is being responsible as a citizen yourself. So these are like the cases. You're someone that is sick and you can help them, give them a list, try to, tell them, okay, this is a thing you're having, and you just go to the hospital. For example, cholera treatment is free in all government hospitals at the moment. There's no reason why you should not go to hospital. There's no reason. But people, you see their neighbor, they say, you don't see kilo for me. I'm sorry. They say, what concerns me? And this attitude of, I better pass my neighbor, what concerns me? It is not supposed to be. You need to be responsible as citizens. And if people that are wealthy, the wealthy citizens among us, should take on public infrastructures. They should build it. I know it's a private sponsor, but they should do public infrastructures for people. It will help. It will help the populace. People must start, they build it and make sure that maybe big organizations, corporations, build interventions, toilets, fiber waters and in communities. Let's spread it, because if you look at our data in terms of open defecation, infrastructure of water, people that are drinking water, it is appalling. It is crazy numbers. You get me? We have about 50 million people openly defecating in Nigeria. About 50 million people. And it happens in about 767 local governments.
Wow.
You are saying wow. It is a lot of it's a very bad reality. About 90% of the population does not have basic infrastructure to wash. Water, hygiene, and sanitation. Completely. 90% of the population. That means that in your house, like your house you are staying, 90% of people don't have toilets in their house. Directly in their house that they can actually access. That's accessible to them. They have running water 24/7, and have soap to wash their hands. You see people building houses that you have to walk 20 miles to go and use it.
Use the facility. That's terrible.
The facility. You see some say, you are a woman, don't use the toilet. Those things. I say, okay, when you are your period, don't come to this place. So that's access. Those are people, like say only people that have access completely. And to all these things in this country is about 10% of the population. So that's crazy numbers. People, you need to step in as a private sector. You need to step in. You have to step in. You need to build facilities. All people, consistent sensitization, promotion. People will not behave better if you don't train them. If you don't do promotion, if you don't do awareness. That is our orientation agency. Sometimes you see them, sometimes they go blank. You don't see them anymore. These are the issues that they need to be. We are endemic to cholera. They need to be consistently. When the season is coming, they should carry their loudspeaker and start saying it. Dry season is coming. When water will be short, they should raise the loudspeaker and say, even now that we have climate change, because climate change also contributes to cholera cases. In fact, every day they should be singing about cholera. So these are like the things that we can do as individuals to help ourselves.
Thank you very much for that, Solomon. Your passion for the subject matter is actually very is contactable. I'm contacting it by virtue of this conversation. What I'm hearing from you is that everyone at every arm of government, including the people, must be responsible. You must be responsible for yourself. You must be responsible for the next person beside you. As a company, you must be responsible for your staff. As government, you must be responsible for the people that you've been elected to serve. And as a person, you must be responsible for yourself. If everyone can take some level of responsibility, we'll see that the cases of cholera reduces. Like you said earlier, there's no reason why you should put up a facility and the place where people can ease themselves is far, far away. What do you expect? Recently, I was at a filling station in Bagada here, and it was my turn to get fuel. And then the fuel attendant said I should excuse her. She wants to ease herself real quick. This thing she said real quick took her 15 minutes. When she got back, I was like, we've been waiting here. The queue has gotten all the way down. Where did you go to? She said the restroom is all the way. Imagine that. That's not helpful.
That's bad. That's not accessible. That's bad.
That's terrible. Like, who was in charge of doing the EIA or other assessment before that structure was built? How does someone who is working here have to travel for 15 minutes to assess the load? That's terrible. It means you're not responsible for your staff. And these are the things we should have in mind when we're building structures, even as business owners. And as a business owner, you're cooking your food, you're running a cafeteria, and you cook with dirty water because, of course, when you're finished cooking, nobody will be able to smell the water. Your environment where you're cooking is dirty. So like you said, everyone must begin to take responsibility. Take responsibility for your business because they are human beings eating from you. Take responsibility for your staff because they are someone's sister, they're someone's brother, they're someone's mother. So thank you very, very, very much, Solomon. I hope this conversation is going to stir up thoughts for everyone that listens to it, in the sense that you need to start asking yourself, how am I taking responsibility for myself and the people around me? So really, 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 it's been a pleasure to have you on Sustainability Matters this week. Although it's a sobering topic, but it's been a pleasure to have you. To our guests and our audience, we say thank you for being with us. We really hope you enjoyed this episode. And yes, see you all next week. Thank you, Solomon.
You're welcome.
Thank you.
Thanks for tuning in to Sustainability Matters. We hope you enjoyed this episode. Don't forget, new videos premiere on our YouTube channel every Wednesday. Follow us across our social media pages to stay updated on the great content we have for you. Until next time, stay green and stay inspired.